Welcome to the Bark for More podcast, the essential guide to raising a healthy and happy dog, from barkformore.com. Hosted by our top-notch team of dog enthusiasts, we're here to help you navigate the health and well-being of your canine friend. It's time to help your dog thrive.
Hello, and thanks for joining us for another episode. Today, we're going to talk about spaying and neutering our dogs. If we've recently welcomed a dog into our lives, the first thing we start to wonder is if we want them to be spayed or neutered. New dog owners are likely to have a lot of questions with regards to spaying or neutering procedures. What's the difference between spaying and neutering? Why should I spay or neuter my dog? Are the procedures risky? At what age should I spay or neuter my dog? Well, the first thing to know is that spaying or neutering can be one of the responsible things to do for our dogs. It can give a lot of healthy benefits to our furry companions. To get a better understanding of spaying and neutering a dog, spaying refers to the surgical procedure for removing the female dog's two main reproductive organs called the uterus and the ovaries, while neutering refers to the surgical procedure done that both apply to male and female dogs. Although some veterinarians today believe that female sterilization can be accomplished by simply removing the ovaries. Consulting our local vet is the first thing to do when considering to spay or neuter our dogs, as they can help us to determine the best age to spay or neuter our pets. Many veterinarians recommend spaying in female puppies before their first heat starts. It usually starts at 5 months, but some veterinarians say that 5 months is too early for our puppies. As our puppies are not yet fully grown and developed, it may be hard and risky for them. Early spaying in puppies may alter their proper bone growth and can cause them injuries. Others may say that puppies that are 8 weeks old can, as long as they're healthy. I recommend asking your local vet first to determine the most appropriate age for the procedure. But why bother spaying and neutering them? By spaying and neutering our pets, we can reduce the number of unwanted litters and be able to control the pet homelessness crisis. These procedures also have their specific health benefits for our furry companions. They can be able to live a longer and healthier life, as it can prevent uterine infections and breast tumors, which are malignant to cancer. Neutering can help our male dogs from having testicular cancer. There are also behavioral benefits for our dogs. Female dogs won't be able to go into heat, which can cause them to cry, howl, be aggressive, and produce vaginal discharge. Male dogs will be less likely to roam around, mount on other dogs, and mark their territories by urine spraying. There is no guarantee that a dog's behavior will completely change once they're spayed or neutered, but it will most likely lessen. The procedure can also eliminate the stress of caring for a pregnant female dog. Spaying or neutering our pets is also cost-effective. It can save us money in the long run for preventing illnesses and conditions that can arise from not spaying or neutering. Some factors come into play before deciding when to spay or neuter. Their health plays an important role. It is best to have them examined before the procedure to know whether it is safe for them to have it or not. If our dogs have a previous medical condition, our veterinarians should know all about it. It also depends on the lifestyle they are accustomed to and their breeds. A dog's breed can make a difference. As Dr. Brown's research has shown, larger dog breeds tend to mature a little later than their smaller counterparts. Dog parents have the choice to decide whether they want their dogs to be neutered or not. Some parents even want their dogs to mate before spaying them. If you've decided to spay or neuter them, it is best for our puppies to recover safely and comfortably. After the surgery, our vet might want to keep our dogs overnight. This is for the reason that our dogs also feel pain and discomfort after the surgery. Our veterinarians can provide the medications needed to lessen the discomfort felt by our pets. However, some veterinarians may allow our dogs to come home after the surgery. Our dogs are provided with a protective collar to keep them from licking the incision. At home, providing our dogs with a safe and quiet place to recover indoors is the first thing that we should do. We need to keep a close eye on them and prevent them from running and jumping for up to 2 weeks. All activities should be restricted while they heal. We need to make sure that our dog is not capable of licking their incision. We should regularly check our dog's incision to make sure that it is not infected and is healing properly. If swelling, redness, or a bad odor caused by the discharge are present, we should immediately contact our vet. Bathing our dog should be avoided for at least 10 days after the surgery. If we notice that our dog is uncomfortable, lethargic, has decreased appetite, or vomiting, these are signs that we need to call the vet and ask for advice. Now that you have learned a little on the subject, it is up to you to do your part to prevent pet overpopulation and keep your dog happy, healthy, and safe.
Thank you for listening to the Bark for More podcast. Don't forget to subscribe to catch every episode. Visit us at barkformore.com to sign up for the latest updates and follow us on social media. Until next time, keep those happy tails wagging.